Thank you for that introduction. So just as you've heard, I was a former medical scientist. I did a PhD in rheumatology. I've worked in politics for a couple of years as a political advisor and speechwriter to the Minister for Science in South Australia. I worked as a journalist, as you've heard, for ABC's Catalyst program, and recently I've been working as a consultant for the Nordic Cochrane Centre. So I'm here in a personal capacity. I'm not here representing the Cochrane collaboration. And today I've been asked to talk to you about the Australian Dietary Guidelines, with particular respect to who has the most influence over these dietary guidelines, and can we trust our government's nutritional advice? Why do we even care? Well, they're actually important because they inform public health policies. They're promoted by all of the public health authorities like the National Heart Foundation and Dietitians Association. They form the basis of hospital food menus, school feeding programs, nursing, home nutrition. Basically, any professional in healthcare has to abide by these recommendations by the government. So it's not an unreasonable expectation to expect that the dietary guidelines are independent, that they're evidence-based, and of course that they're trustworthy. So that's what I'm going to talk to you about today. But before I do, I need to give you a bit of background on how these guidelines are brought about. So the National Health and Medical Research Council is the government body that's responsible for compiling the dietary guidelines. So the NHMRC is what we refer to them in short. They're written every 10 years. The last version was published in 2013. So the next one is due 2023. And this is quite a difficult task to undertake. It requires expertise. So in 2008 to 9, the NHMRC issued a request for tender, looking for a group of individuals who could undertake a systematic review of the scientific literature to update the dietary guidelines. And the grant was worth just over $500,000. Under the requirements of this tender, the successful contractor, according to the NHMRC, is not allowed to have a conflict of interest that exists or that is likely to arise during the performance of this contractor's obligations. They define a conflict as something which may or may even appear to impair the ability of the contractor to carry out the services diligently and independently. So who did they contract? The Dietitians Association of Australia, if you're not familiar with them, is the peak body that represents the accredited practicing dietitians in Australia. So the question was, are they independent? We've known from investigations in the past, and I've certainly been doing investigations for the last year and publishing with michaelwest.com about their conflicts of interest. As we've heard, they've recently announced that they're severing their ties with the food industry by the end of the year. But did they have a conflict of interest way back when they were actually compiling the dietary guidelines? So, according to their own annual reports, the Dietitians Association in 2007 had relationships with Kellogg's, Unilever, Nestle, Novartis, so drug companies and the food industry, and they continued right throughout to 2010, and they actually continued throughout this year, but this is just to demonstrate that these conflicts or the relationships with the food industry actually existed before, during and after the tendering process. Also this year it was revealed that the Dietitians Association had a relationship with the Australian Cereal Breakfast Manufacturers Forum. So this is an industry front group representing the cereal giants, Nestle, Kellogg's and Sanitarium. And these were documents that were probably uploaded accidentally by the group, and they revealed some quite embarrassing facts about their strategies behind closed doors. Firstly, it was revealed that the Dietitians Association was taking money from this industry front group, and that they were supplying the Dietitians Association with educational learning materials that were often written and developed by the cereal industry. They also talked about their media strategies in some of the boardroom meetings where they would co-opt the loyalty of dietitians, ones who they thought had media influence, so they could tweet or Instagram pictures of cereal bowls and tell people how delicious and nutritious they were. And probably the most disturbing part of these documents was the revelation that one of their strategies was to undertake active defence against people who threatened their branding and messaging. Now, I was one of those people that was named in those documents in response to the low carbohydrate documentary that I did for the ABC. So the strategy is to get dietitians out there writing articles talking about how terrible these people are, I am, and how irresponsible these messages are, because it was threatening the branding and messaging of cereals. Pete Evans, Sarah Wilson, Dave Gillespie, the author of Sweet Poison, were named as targets for active defence, and also, disturbingly, Gary Fettke was named as one of those targets, and we saw what happened there. This is the actual letter that was sent to Gary Fettke's hospital, Launceston General Hospital, to the chief executive. It was a complaint that was lodged by the Dietitians Association, and apologies for the small writing if you can't read it, but it says there that in the DAA's view, Gary Fettke was dishing out some alternative nutrition views by telling his patients to eliminate sugar and polyunsaturated fats from the diet. And according to them, this was not current evidence-based practice. So the author of that letter was Claire Hewitt. She's the lady on the right of the screen. She's the former CEO of the Dietitians Association, and she actually stands next to the South African dietitian who lodged the complaint against Professor Tim Noakes and then sent him on a path of 3 to 4 years of defending his medical licence. So you can see a charming group of people. So we took all of this information. We've shown that the Dietitians Association admits they have a potential conflict of interest. These documents that were leaked actually showed that these conflicts of interest were actual conflicts of interest. And we took that information to the NHMRC, and they said that in the tendering process, the Dietitians Association did reveal that they had potential conflicts of interest by way of having a number of corporate partners. However, the NHMRC did not believe that these potential conflicts of interest were considered to be actual conflicts of interest. So what do you think? A show of hands. Does that pass the sniff test? I mean, who thinks that that's a legitimate argument? Okay, well, I tend to agree with you. However, the DAA does not. They say that corporate partnerships do not influence our decision-making with the DAA, and when we ask the experts, for example, Dr. Marion Nestle, she's a professor of nutrition, food studies and public health at New York University, she says that statements like that strain credulity, and that decades of research and thousands of studies demonstrate the influence of funding on the outcome of research and opinion. And she goes on to say that disclosure is not enough to prevent conflicts of interest, and that the influence is there, but funding recipients do not recognise it and, as in the case of the DAA, typically deny it. So we have a government nutrition policy where the government has, in many people's view, breached their own policy on conflicts of interest. So who are these dietary guidelines relevant to? When you go to the webpage, it actually states that the Australian Dietary Guidelines apply to all healthy Australians. So you can have some common health conditions like being overweight, but they do not apply to people who have special dietary advice for medical conditions. So this includes metabolic syndrome, insulin resistance, type 2 diabetes. None of these chronic metabolic diseases need to be treated with the Australian Dietary Guidelines. So when you go to the GP and you have type 2 diabetes, what advice does your GP give you? Well, according to the Royal Australian College of General Practitioners, GPs are to advise that their patients with type 2 diabetes have to eat according to the Australian Dietary Guidelines. So we have a situation where GPs in this country are instructed to advise their patients with chronic metabolic diseases to have a diet based on the Australian Dietary Guidelines, which was never designed for them. All right, so what have we got? Potential breaches in conflict of interest. We've got guidelines that are not relevant to a significant proportion of the population. Are they at least accurate? Let's have a look at some of their claims. On page 247 of the Dietary Guidelines, they talk about the evidence behind whole grains and cardiovascular disease. They say that consumption of 1 to 3 serves per day of whole grain cereals is associated with a reduced risk of cardiovascular disease. And they say they have excellent evidence base for making this comment. And they quote a systematic review by Cochrane from 2007. So when you actually go to the study, what does it conclude? It actually says that none of the studies found reported the effect of whole grain diets on cardiovascular or coronary heart disease mortality, events, or morbidity. And it goes on to say that many of the trials identified were short-term, poor quality, and had insufficient power, and that most of the trials that were funded by companies with a commercial interest in whole grains. So the Australian Dietary Guidelines is making dubious claims about the benefits of whole grains for reducing the risk of cardiovascular disease, and they're citing studies to support that statement that concludes the complete opposite to what they're saying. What about whole grain cereals and type 2 diabetes? Page 261 of the Dietary Guidelines, it says consumption of cereal foods, especially 3 serves of whole grains, is associated with a reduced risk of developing type 2 diabetes. They say the evidence for this statement is good and that they have level 1 evidence, which is the highest level of evidence. Again, they cite Cochrane Systematic Review from 2008. And when you go to the review, what does it say? Lo and behold, the evidence from only prospective cohort trials is considered to be too weak to be able to draw a definitive conclusion about the preventative effect of whole grains on the development of type 2 diabetes. So there's breaches in conflict of interest policy. These guidelines are not relevant to a significant part of the population. We have errors in judgment and citations that actually conclude the complete opposite to the claims they're making. What about when they do get the citations right? Are the studies scientifically robust? A lot of these studies are actually based on epidemiology, and as you've heard, these observational studies only look at patterns and distribution of human disease, and with the exception of smoking, which has a very strong correlation to the development of lung cancer, most of the observational data is only weakly positive, especially in the field of nutrition science, because correlation doesn't equal causation, and it is riddled with confounding factors. So, for example, the claims that vegetarians are healthier than people that eat meat is confounded by factors where perhaps vegetarians smoke less, or they exercise more, they go to their doctor more, they're more compliant with doctors' regulations. So those are reasons that might confound the result, and that vegetarians are in fact not healthier because they don't eat meat. This has resulted in very conflicting health messages, as we've seen. In the Lancet of Public Health, a study was published saying that low carbohydrate diets shorten lifespan. It garnered international attention. Low carbohydrate diets reduce or shorten lifespan, past the pasta. Carb diets linked to lower life. So all of this was based on an observational study over 20 odd years, where they asked people twice what they thought or what they could recall they ate. So it was based on a patient's recall of what they had eaten. A paper in the Journal of Clinical Epidemiology looked at this controversy and especially looked at memory-based methods. So this is where patients are asked about what they ate. Do they recall accurately and are they really honest? They found that over 1 million articles published in the broad area of diet and health since 1946 used memory-based methods, and they concluded that they are pseudoscientific and that they should not be used to inform public policy or establish dietary guidelines. And they finish off by saying that confusion over what to eat is influenced by 5 decades of deeply flawed, demonstrably misleading and largely pseudoscientific epidemiological reports based on dietary assessments. Don't take their word for it. Professor John Ioannidis, a very respected professor from Stanford University in July this year, said nutrition science still largely relies on observational studies and that they are notoriously unreliable due to confounding factors, so that they need to be largely abandoned. He says we've wasted enough time or enough resources, caused enough confusion, and now we need to refocus. So what can we conclude about the Australian Dietary Guidelines? Well, we've had government potentially breaching its own policy of conflicts of interest. We have guidelines that are not relevant to a significant proportion of the population who have chronic metabolic diseases. The guidelines contain some serious errors in judgment, making dubious claims where studies are cited that conclude the complete opposite of the claim that they're making, and that the majority of the studies used to underpin our dietary guidelines are not scientifically robust, and most of them are industry funded. So without concluding anything myself, I'll tell you the conclusions of Dr. Melanie Vervoden, who is a dietitian and a health economist. She recently said that no matter how you dress it up, the current guidelines have driven production and consumption, and until we get better evidence, let's delete the Australian Dietary Guidelines. The sky will not fall in. So there is the publication that michaelwest.com recently published, and has a little bit more information in it if you want to refer to it. But I'm going to leave it there. Thank you.